Hello, I'm Patricia Hesnan. I'm going to demonstrate for you how you can apply a castor oil pack to a swollen joint for yourself or for anybody else. What you will need for this castor oil pack is 2 plastic jugs, a small one and a medium-sized one, an old saucepan preferably because the smell of the castor oil can remain in the saucepan, cling film to wrap around the joint, as scissors to cut the cling film and also to cut your flannel, a piece of woolen flannel. It's woolen flannel because it helps to retain heat. And then to pull up over the knee, once all this has been applied, you can use the sleeve of an old woolen jumper, and what I've got here is an old woolen hat. It keeps the heat in. Earlier, I cut the top of an old woolen hat, which I can use as a sleeve to pull over the knee joint. This helps to keep in the heat around the knee. You could also use the sleeve of an old woolen jumper if it was wide enough to pull over a knee joint. You can wash and use this sleeve again and again, but it would be advisable to put on a new flannel as a dressing each time. You need elastoplast, and that is to secure all the bandaging. And it's going to be on for three nights. You change it each night, so it's on 3 nights on, 3 nights off, 3 nights on. Your scissors is here to cut your elastoplast, and also you will have already cut your bandage to the proper length. What is important is to remember, when you heat this oil, you heat it to a point of being hot, not boiling. If you boil it, it's too hot. So when it's at that, it's just hot, that's when you dip in your flannel. Then you take out your flannel, you apply it, you then wrap around the cling film, and then you reinforce this and tie it with your elastoplast, and then you pull this up on the knee, over the knee, above and below where the injury is, and reinforce that again with your elastoplast. So this is not something you would use during the day because it wouldn't stay on. So it's 3 nights on, 3 nights off, and 3 nights on again. And again, as I said, these little measuring jugs, so it's 3 of them of castor oil and 1 of them of pure spirit. And if somebody is sensitive to alcohol, you don't put it into it at all. You need a support for the ankle, a towel, an old towel preferably, because the oil is going to splash on it, and also advisable a plastic covering. That it can be an old tablecloth, because if you're applying it on the bed, it can soak through the towel or onto the floor and it can be slippy. So these are the ingredients you will need before you start at all. These packs can be applied not on a joint where there's an open wound, and we mix 3 parts castor oil with 1 part pure alcohol. You then dip your woolen flannel into, we'll say the castor oil is in here, you dip that in. Of course, you would probably have it nearer to you than I have it here at the moment. You take it out and then you wrap it around. It's very sticky, very messy, but you wrap it around the joint, above, below, and make sure it overlaps. So you're going under the joint, over the joint, and right down again under the joint. Now, just to be on the safe side, we're going to put a bit of sellotape onto this to hold it in place. So you have your scissors here. So you've already prepared that, and just fasten that in place that it doesn't fall off. Okay. Now, the reason for the cling film is, first of all, it stops the liquid from pouring all over the place. And the other reason for it is it keeps in the heat. So you get your cling film, you go round the joint, underneath the joint. Now, some people will be doing this themselves, and it is actually quite easy to do it yourself on your own knee. Now, be careful with cling film that you don't wrap it too tight, because it can be, if you wrap it too tight or with a bandage, it can be very uncomfortable. So you just need enough to stop all that liquid from pouring off the bandage. Okay, now you have it above and below. Okay, so now you get your old woolen, as I have here, a hat, and you pull that up over the joint. Okay, so I'm going to ask this gentleman if he can lift his leg. Just 1 second. I'm going to, and it'll go up nice and easily over that now, because the cling film is shiny. So you have it above the joint and below the joint. Okay. Now, and the reason again for using wool is it retains the heat. It's a natural fabric. Then you get your elastoplast, and you could have a wider tape than this one, and you go round the joint and sticking it to the leg, also to the wool that will hold it in place. So you make sure you could have a wider piece, but you may need to go around it, and I'm not going to stick it on this person's leg because it's not very comfortable. So when you've all of that done, this is usually done at night. So it's 3 nights on, 3 nights off, 3 nights on, and then you can leave it for a month. You don't have to do it for 6 or 7 nights, one after another. You can leave that for a month and don't do it again unless you need to. Approximately 20 years ago, a young man came for therapy. He had swelling in both his knees. His doctor suggested it could be arthritis. He took his medication, but the swelling didn't go down. So after a number of sessions of therapy, we decided maybe we could try, or he could try, the castor oil packs. As he was a plumber, he was kneeling on wet ground, he was in drafty conditions, and he found it difficult to bend his knees. It was more the bending than actual pain. So he tried the castor oil packs, as in 3 nights on, 3 nights off, and 3 nights on. And then the decision was we'd leave it for a month then and see how he got on. The swelling went down and it never came back again. So he was fine. It did work for him. So this is something you could try for yourself or for somebody else. Thank you very much for watching, and if you have any queries, please send us an email.